it seems in modern medicine and even in building maintenance, right? People are quick to try to treat a symptom, but they're not so quick, or don't want to make the commitment to look at the underlying causes of the symptoms that are presenting. So, Dr. Ovadia, maybe you can talk to us a little bit about when you start to look at someone's medical health and do that workup. What is the difference between looking at the root cause and just the symptom?
Sure thing. And you're exactly correct. You know, our healthcare system is built around managing symptoms and managing disease. And it is infrequent that, our healthcare system, our physicians uh, do get to those root causes of the problem. But it's amazing what can happen when you do that. Because I now see, on a routine basis with the patients that I work with and other physicians that I, interact with that use similar methods, that we can reverse many of the chronic diseases that we are facing, things like diabetes and high blood pressure. And by doing so, we can prevent, the big things that we all get concerned about, things like heart disease and cancer and Alzheimer's disease. And that all comes from asking the questions and looking for those root cause problems, the root causes of these problems. And you have to start again with, what is the food that you are eating? What is the air that you are breathing in like? All of these things, that we find the vast majority of the time are the problem. Occasionally, of course, there are, things that go wrong with our bodies, genetic things or otherwise, that, may have to do with the, might not have to do with the environment. But the vast majority of the time, what I end up seeing is that these problems start with the environment. And one interesting parallel, just to note, that we were talking about the statistics about, how many of the buildings are unhealthy. Well, we see the same thing with people. We know, for instance, that 88% of the adults in the United States are not metabolically healthy, almost 9 out of 10 people. And we need to start asking why that might be. And, again, it comes down to what we're eating, what we are breathing in, and how we are interacting with our environment.